Every year, approximately 400,000 ACL injuries occur in the United States, resulting in ACL reconstruction being one of the most common orthopedic surgeries. And now a new procedure available to patients at Shriners Children's Greenville is making better results possible and faster healing likely. Dr. Ashley Startzman and Trinae Pittman with Shriners Greenville Hospital, Shriners Greenville is here with us to talk all about it. I mean, fall sports kind of just kicked off. My middle is playing football, so every day I'm just like, watching like this. So what is the most common way a child may tear their ACL? And then, what should you do immediately if you suspect that happens?
So the most common way an ACL injury occurs is through a cutting or pivoting, twisting type injury while running or playing a sport. And if you do suspect that your child has sustained an ACL injury, what we recommend is that initially you try to stay off of that leg until you're evaluated by a medical professional, and then ice, elevate the extremity, a compressive wrap, and then schedule an appointment with your doctor. And at Shriners Children's, we actually have an injury care clinic with same day and next day availability, and we'd be glad to take care of your child at Shriners.
See, because that's always like the confusing part for parents is like, do I call Shriners right away? Do I go to my doctor right away? Like, what's the do I go to urgent care?
Right.
What's the
whatever you're comfortable with, honestly. If the injury is pretty severe and you're bleeding or lots of swelling, lots of pain, then I would suggest an urgent care emergency department.
Right.
But if the pain seems like it can be controlled well, then I think it's okay to either follow up with your primary care doctor and get a referral or call us for an appointment, either way.
Yeah, because that can be the tricky thing with ACL. Sometimes it's, you don't know, you got to wait until you did something. And please don't let it be
exactly
ACL. But you've got this new procedure, BEAR. Tell me about it and the benefits.
So the BEAR is the most exciting, innovative advancement in ACL reconstructive surgery in the last 20 years or more. And so it's been out for about 4 years now. So traditionally, if you needed ACL surgery, what we would do for that is go in and completely remove the remnants of the ACL, make another incision where we harvest a healthy tendon, and then make bone tunnels in the femur and the tibia to remake an ACL. But what's great about the BEAR procedure is that this implant actually allows you to go in with a more minimally invasive technique and repair your own ACL so that you can keep your native anatomy.
That seems like the healing process would be maybe quicker and maybe not as painful.
It can be less painful because you're avoiding an extra incision and you're keeping your native anatomy. And lots of patients have less swelling initially, which is really great. The total time to healing, honestly, is about the same with a standard ACL because you have to allow the body to repair this ACL.
You don't want to go too early,
Right.
Yes. Okay, who all qualifies for this and who all qualifies for being a patient at Shriners?
Well, that's the great thing is we accept patients 17 years and younger for your first visit, which is right at that target age of when you might injure your ACL.
Yes.
And as you mentioned, you can go to your primary care first, but you're welcome to call Shriners directly to make that appointment and be able to meet immediately with one of our orthopedic surgeons like Dr. Startzman.
I mean, Shriners, is there anything you don't do?
If it's orthopedics, there's very little we don't do.
We got it all. Y'all are amazing. ShrinersChildren.org is where you can go learn more. Thank you so much for telling us about this, and hopefully this will help put parents' mind at ease just a tad when it comes to kids and any injury. So thank you.
Thank you
so much,
Thanks
ladies.
For having